She almost didn't stop. Leftovers were waiting at home, not even particularly hungry. But the Speedway was right there, and she was more tired than she'd realized, and the sushi roll was $6.49, and she grabbed it without thinking. 4 days later, Lisa Chen was in a hepatology unit at the University of Cincinnati Medical Center with acute liver failure. Her eyes were yellow, skin yellow. Her liver enzymes were 40 times the upper limit of normal. The sushi roll was already gone, eaten, forgotten, thrown away. The virus it carried was not. This is system failure. Lisa Chen was 34 years old, a paralegal from Mason, Ohio, presenting with acute hepatitis A infection and fulminant liver involvement after consuming contaminated prepared food 4 days earlier. She lived alone. Her mother Janet flew in from Portland the same morning she was admitted. She called me at 6 a.m., Janet said later. She said her eyes looked weird in the mirror. I told her to go to the ER immediately. A pause. She almost talked herself out of it. She said it was probably nothing. It was not nothing. 3 days earlier, Lisa had felt completely fine. Tuesday afternoon, a Speedway off Interstate 71 on her drive home from work. She was not someone who ate gas station sushi regularly. She knew it was a questionable choice. She made it anyway because she was tired, and the display case was right there. One spicy tuna roll, vacuum sealed, best before Thursday. She ate it in her car in the parking lot. It tasted fine. She drove home, watched television, went to bed. Wednesday, nothing. Thursday, nothing. Remember the distribution facility that made that roll? We'll come back to it. Here is what hepatitis A does. A virus, not a bacterium, not a parasite. It is one of the most contagious foodborne pathogens the human body can encounter, and one of the few that targets the liver almost exclusively. Once swallowed, hepatitis A travels silently through the digestive system and enters the bloodstream. It reaches the liver within days and begins replicating inside hepatocytes, the liver's primary working cells. The immune system eventually detects the invasion. But here is the mechanism that makes this virus so destructive. The liver cells themselves are not killed by the virus. They are killed by the immune system attacking the cells the virus has infected. The liver destroys itself trying to fight back. In most adults, this process causes a severe but survivable illness. In a small number, particularly those with no prior immunity and no vaccination, the immune response is so aggressive that liver function collapses entirely. This is called fulminant hepatic failure. Mortality without transplant can exceed 50%. And here is the detail that makes hepatitis A uniquely dangerous in a food safety context. The incubation period is 15 to 50 days. The average is 28 days. Lisa developed symptoms in 4 days, an outlier, but not an impossible one. More importantly, during that entire incubation window, the infected person feels nothing and is already contagious. The food handler who contaminated Lisa's sushi roll almost certainly felt completely well that morning. He had no idea. Wednesday, nothing. Thursday, nothing. Friday morning, a fatigue that felt different from tiredness, deep and unshiftable, the kind that coffee made no difference to. Lisa assumed she was getting a cold. By the afternoon, nausea had joined it. She skipped lunch. She left work an hour early. That evening, her urine was dark, the color of strong tea. She Googled it, found dehydration, drank 2 glasses of water, and went to bed. Saturday morning, she looked in the bathroom mirror. Her eyes were yellow, not slightly yellow, not ambiguously yellow, the whites of both eyes, unmistakably completely yellow. She called her mother. Her mother told her to go to the emergency room immediately. She almost talked herself out of it. University of Cincinnati Medical Center Emergency Department, Saturday morning. The ER physician ordered a liver panel immediately. Jaundice in a 34-year-old with no history of liver disease or alcohol use triggered the right instinct. Results came back within the hour. AST was 2,800. The normal upper limit was 40. ALT was 3,100. The normal upper limit was 56. Bilirubin was 14.2. The normal upper limit was 1.2. The liver was failing in real time. Standard differentials were worked through, including gallstones, autoimmune hepatitis, and drug-induced liver injury. A full medication and supplement history was taken. An ultrasound was ordered. Nobody asked what she had eaten in the past 2 weeks. The question of where her food had come from was never raised. The hepatitis panel, including hepatitis A IgM, was ordered as part of a broad infectious screen. It came back strongly positive 48 hours later. By that point, Lisa had been in hospital for 2 days already, treated for liver failure without anyone knowing the cause. When the result came back, the attending physician asked one question. Have you eaten any prepared food recently? Sushi, deli food, anything prepackaged? Lisa thought for a moment. I had a sushi roll from a Speedway on Tuesday. The physician made a note. Then she made a phone call to the Ohio Department of Health. Lisa was not the only one. The FDA and CDC investigation traced the contamination to a single distribution facility in Kentucky that supplied prepared sushi rolls to gas stations and convenience stores across 4 states. 23 confirmed cases, all from the same production batch, all from the same food handler, a temporary employee who had worked one shift while infected and was unaware he carried the virus. His employer had no mandatory hepatitis A vaccination policy. The facility had last been inspected 14 months earlier. Lisa spent 11 days in hospital. Her liver function stabilized without transplant. She was in the minority who recovered without surgical intervention. She would need annual monitoring for the remainder of her life. Her hepatologist told her that her liver would always carry the evidence of what happened to it. Janet said one thing afterward that stayed with me. She almost didn't stop at that gas station. She told me that. She almost just drove past it. A pause. I don't let myself think about what almost means. Here is the system failure. Not Lisa, not the Speedway, not even the food handler who did not know he was infected and had no policy requiring him to be vaccinated. Structural failure is what this is. Hepatitis A vaccination is a 2-dose series. It is fully protective. It costs around $150. The CDC recommends it for all adults. It is not universally offered at routine checkups. It is not on the standard adult wellness form at most primary care practices in the United States. The question, have you had your hepatitis A vaccine, is not asked. Lisa had never been offered it. Not once, across 14 years of routine medical care as an adult. One shot would have made this entire story impossible. Ask your doctor one question at your next appointment. Have I had my hepatitis A vaccine? Am I up to date? If the answer is no or you don't know, ask for it. 1 shot, 2 doses, fully protective for life. The information has always existed. The question simply never made it onto the form. Lisa Chen almost didn't stop at that gas station. She grabbed a sushi roll because she was tired, and it was there. And it was $6.49. Her liver failed 4 days later. The virus was already in the roll before she touched it. That is the system failure. This is system failure. I'll see you in the next waiting room.